15 silent signs that seem like gas, but may indicate something serious. You feel gas frequently, that bloated belly, discomfort, pressure, and you always think, it's normal, everyone has it? What if I told you something different? In some cases, this can be a silent sign, a sign of something much more serious, happening inside your body. The problem is that most people ignore it. They live with it for months, or even years. They drink herbal tea, change a food, avoid beans for a week, and think they've solved it. Until one day, the diagnosis arrives, and it's already advanced. But calm down. This isn't meant to scare you. It's meant to alert you in time. Today, you'll discover 15 signs. Signs that seem like just gas. But that may indicate serious health problems. And most importantly, how to identify when it's something simple, and when it's time to act immediately. Stay until the end. Sign number 7 and number 12 are the most ignored, and also the most dangerous. And there's one sign on this list that you can test right now, while you're reading. If it hurts, pay attention. Sign 1. Belly always bloated. Even without eating much. You look at your abdomen, and it seems puffed up. The time. Even when you eat little. Even when you wake up, before putting anything in your mouth. The feeling is that the belly never truly deflates, as if there's a constant pressure from inside. Most people dismiss this as normal gas and move on. And maybe it is, but there's an enormous difference between the bloating that passes within a few hours, after digestion, and the one that simply won't go away, regardless of what you eat or don't eat. When the abdomen seems permanently puffed up, the body may, signaling something. Chronic poor digestion, undiagnosed food intolerances, active intestinal inflammation, or, in more serious cases, inflammatory bowel diseases, or abdominal tumors. Ovarian cancer, for example, is called the silent killer, precisely because its first visible sign is often this: a belly that won't deflate. That's simple. That's silent. Women spend months with this symptom thinking it's menstrual, or dietary bloating, while the tumor grows. When to worry? If the distension is daily, worsens throughout the day, even without eating much, doesn't respond to any dietary change, and comes accompanied by unusual tiredness or involuntary weight loss, it's time to see a doctor. Not next week, this week. And sign 2 will show you why gas with pain. Never be ignored. Sign 2. Gas with frequent abdominal pain. Feeling gas without pain is common. The intestine naturally produces gas during digestion. That's absolutely normal. But gas accompanied by pain is different. Especially recurring pain. Pain that comes back on the same days, at the same times, with the same intensity. This is not normal, and should never be treated as such. The pain that accompanies gas may indicate something. Irritation or inflammation of the intestinal mucosa, colon spasms, irritable bowel syndrome inactivity, or, in more serious cases, partial intestinal obstructions, where something prevents the normal flow of digestive content. The problem is that many people take a painkiller, temporarily relieve the pain, and repeat the cycle for months, without ever investigating what's causing that discomfort. The painkiller hides the symptom. It doesn't treat the cause. Recurring pain is the body asking for attention, not asking to be silenced with a pill. When to worry? If the pain appears more than twice a week, if it wakes you up at night, if it doesn't completely disappear even after a bowel movement, or after using medication, this deserves a medical evaluation, with imaging and laboratory tests. But what if you've already tried everything and nothing works? Sign 3 is exactly about that. Sign 3. Gas that doesn't improve with absolutely anything. You changed your diet. You cut out beans, cabbage, kale, soda. You drank fennel tea, chamomile tea, peppermint tea. You bought probiotics, fiber, digestive supplements, and nothing. The gas continues, with the same intensity, the same frequency, as if there's nothing you can do to improve it. When no intervention works, it's a powerful sign. The problem is not superficial, and is not in the food choices. It may indicate severe dysbiosis, a deep and chronic imbalance of the intestinal microbiota, bacterial overgrowth in the small intestine, enzymatic problems that prevent adequate digestion, or more complex conditions that simply don't respond to simple dietary changes. A body that doesn't respond to any change is sending. Clear message. The problem is deeper than you imagine, and only a professional can find it. When to worry? If the gas persists for more than 3 weeks, without responding to any dietary change, especially when accompanied by other symptoms, persistent fatigue, unexplained weight loss, or changes in bowel habits, it's time to investigate with specific tests. Sign 4 is what no one talks about openly, but that can reveal a lot about what's happening inside. Sign 4. Gas with an extremely strong and foul odor. This is one of the most ignored signs, and one of the most revealing. Gas naturally has an odor, a result of the bacterial fermentation that happens in the large intestine during digestion. That's normal. What's not normal is when that odor becomes very intense, consistently very intense, unbearable, different from what it always was, without you having changed anything in your diet. Gas with an excessively foul odor on a persistent basis. Be related to something. Severe intestinal dysbiosis, poor absorption of proteins and fats, undiagnosed lactose intolerance, active Crohn's disease, or, in more serious cases, intestinal bleeding. This last point is important. Blood retained in the intestine ferments, along with the digestive content, and produces gas with a characteristic odor, very different from the usual. When to worry? When gas with a very strong odor is accompanied by diarrhea with blood or mucus, intense abdominal pain, involuntary weight loss, or fever. Medical evaluation is urgent. Don't delay. Sign 5 is what kills most silently, and the pain doesn't even appear where the problem is. Sign 5. Pain that radiates to the back. You feel discomfort in your abdomen, but the pain seems to go to your back, to the lower back. You think it must be the spine. You stretch. You apply a warm compress, and it improves a little, but it comes back. This cycle can last months, while the real problem progresses untreated. This is probably the sign with the greatest potential to lives, and also the least known by the general population. There's a phenomenon called referred pain, pain that originates in an internal organ, but is felt in another part of the body, because the nerves share pathways in the central nervous system. The pancreas sits deep in the abdomen, between the stomach and the spine. When it becomes inflamed or develops a tumor, the pain manifests in the upper abdomen and radiates directly to the lower back. Many patients spend months being treated for herniated discs or chronic lower back pain, when, in fact, the pancreas is in crisis. And the detail that matters most. Pancreatic cancer has an 85% mortality rate when detected late, precisely because it's silent in the beginning. The first noticeable sign? Often, it's exactly that pain. The pain that seems to be coming from the back. When to worry? If abdominal pain radiates to the lower back, worsens after meals, comes accompanied by intense nausea, fever, loss of appetite, or yellowing of the skin and eyes, and doesn't improve with common anti-inflammatories, seek medical attention immediately. Sign 6 will show you why losing weight, without wanting to, may be the greatest alert the body sends. Sign 6. Unexplained weight loss. You're losing weight without dieting, without exercise, without any conscious change in habits. And yet, when you step on the scale, the numbers drop. 1 week, 2 kilos. The following month, 1 more. Clothes start to become loose. People start to comment. This seems good. It's not. Involuntary weight loss is one of the greatest warning signs in all of internal medicine, especially when associated with digestive symptoms, frequent gas, constant abdominal distension, or changes in bowel movements. It may indicate that the body simply isn't able to. Nutrients, even when the diet is adequate, or it may indicate something more. An active inflammatory or oncological process, silently consuming the body's energy reserves. Intestinal, gastric, and pancreatic cancer frequently manifest this way in early stages, with vague digestive symptoms, and progressive weight loss that the person attributes to stress, or to metabolic changes with age, or simply to eating less due to lack of appetite, which by itself is already a warning sign. When to worry? Any loss of more than 5% of body weight in less than 6 months without an identified intentional cause and associated with any digestive symptom needs to be urgently investigated. Don't wait until it reaches 10% to act. And sign 7, which I promised at the beginning, is exactly here. One of the most ignored, and one of the most dangerous. Sign 7, feeling of always being full. Early satiety. You sit down for lunch, you serve yourself a normal plate, you eat 2 or 3 forkfuls, and you're already full. The feeling is that your stomach has shrunk, that there's no more room, that if you eat more, you'll vomit. You leave half the plate. This repeats at dinner, and at breakfast the next day. This symptom is clinically called early satiety. It is usually attributed to trapped gas in the stomach, slow digestion, or anxiety. But it can be a sign of gastroparesis, when the stomach loses its ability to empty normally. Food stays retained for hours, causing that constant feeling of fullness. It can also be a peptic ulcer, compression of the stomach by neighboring organs, or, in more serious cases, gastric cancer. The tumor in the stomach physically reduces the internal volume. The organ. The person eats less and less, not because they don't want to eat, but because they literally can't. When to worry? If early satiety is progressive, worsening week by week, and comes associated with weight loss, episodes of vomiting after meals, or persistent pain in the pit of the stomach. Don't wait. See a doctor and request an endoscopy. Sign 8 seems too trivial to worry about, but it's one of the most reliable warnings of intestinal cancer. Sign 8. Recent change in bowel function. Your bowel has always been regular. You knew exactly what to expect. With what frequency, at what time. And suddenly, without any change in diet, stress level, or lifestyle, everything changed. Your bowel became constipated when it never was, or became loose when it was always regular, or started alternating between the two extremes, with no clear pattern. A recent and persistent change in bowel habits is one. The most important signs. Stools that become very thin. Pencil or ribbon-shaped. Bowel that starts alternating between constipated and loose repeatedly. Intense urgency to have a bowel movement. That didn't exist before. Or the feeling of never fully emptying. All these signs can indicate something serious, from irritable bowel syndrome to growing intestinal polyps, or colorectal cancer. Colon cancer can grow silently for years without causing pain, but it affects the shape and functioning of the bowel before causing any other symptom. The change in bowel habits is usually the first and only sign it emits in the early stages. When to worry? Any change in bowel pattern that persists for more than weeks without apparent cause, especially in people over 40, or with a family history of colorectal cancer, should be evaluated with a colonoscopy. Don't delay this exam. Sign 9 affects a huge portion of the population, but almost no one brings it to the doctor. You'll recognize it immediately. Sign 9, gas with diarrhea or chronic constipation. Your bowel is constantly dysregulated, one day completely constipated, unable to have a bowel movement for 2 or 3 days. The next day, intense, urgent diarrhea. Difficult to control, and throughout this cycle, lots of gas. Distension. Abdominal discomfort that won't pass. You've gotten used to it, you think it's your normal, but it's not. This pattern can be a classic sign. A sign of irritable bowel syndrome, which is real, diagnosable, and treatable. But it can also indicate something else. Undiagnosed lactose intolerance or gluten sensitivity. Active Crohn's disease or ulcerative colitis. Persistent intestinal parasites. Parasites that the body can't eliminate on its own. Or problems in the absorption of certain nutrients, causing excessive fermentation and chronic intestinal instability. The bowel is a direct reflection, a reflection of the body's overall health. When it's chronically unstable, the entire body feels the consequences. Low immunity, altered mood, constant fatigue, dull skin. All of this can start in the intestine. When to worry? Diarrhea with mucus or blood. Constipation lasting more than a week without response to laxatives, or rapid and frequent alternation between the two states. Associated with intense pain or weight loss. These are signs that require medical evaluation and specific tests. Sign 10 will show that sometimes the stomach gives warnings. Warnings in a way you'd never associate with it. Sign 10. Frequent nausea without apparent cause. You wake up with nausea, even before eating anything. You already feel that unpleasant sensation in your stomach. You feel nauseous after meals. as if what you ate is coming back up. Waves of nausea appear throughout the day, without warning, without any clear reason you can identify. You're not pregnant. You haven't taken any new medication. You haven't traveled. But the nausea is there, day after day. When nausea is frequent, it may indicate something, especially in the morning, or consistently associated with meals. Erosive gastritis, duodenal ulcer, gallbladder problems, low-grade chronic pancreatitis, or liver diseases in their early stages. Constant nausea is especially concerning in adults over 40. It can be the first visible symptom of tumors in the pancreas or liver, organs that remain completely silent for a long time before generating clear symptoms. When to worry: if nausea lasts more than a week without an identified cause, comes accompanied by progressive loss of appetite, high abdominal pain, yellowing of the skin or eyes, or wakes you up at night, seek a doctor immediately. Sign 11 doesn't seem digestive, but the origin may be in your intestine. Sign 11. Constant fatigue linked to the abdomen. This one surprises many people. But yes, a dysregulated intestine can cause extreme tiredness. Tiredness disproportionate to the physical or mental effort you make. You sleep 8 hours and wake up tired. You rest on the weekend, and by Monday, you're already out of energy. You feel as if the batteries never fully charge. When the digestive system doesn't function correctly, the body doesn't. Nutrients adequately. Vitamins, minerals, proteins, everything passes through the intestine without being used. Without the right nutrients reaching the cells, energy production drops. The result is a fatigue that doesn't improve with sleep, tiredness disproportionate to the effort, lack of concentration, constant discouragement, and a feeling of functioning below your potential. Anemia from iron deficiency caused by chronic, and silent gastrointestinal bleeding, never diagnosed celiac disease, and inflammatory bowel diseases. These are frequent causes of severe fatigue. Fatigue that people spend years attributing to stress, a busy life, or simply the natural aging process. When to worry: if tiredness doesn't improve with adequate rest and is associated with any frequent abdominal symptom, especially visible paleness, involuntary weight loss, or recurring fever without apparent cause, it's time to request complete blood tests and a digestive system evaluation. And we arrive at sign 12, the most ignored of all, and the one that can become irreversible if you keep waiting. Sign 12. Frequent heartburn or acid reflux. Heartburn is so common that it has become synonymous with too much. Everyone has it. Everyone takes an antacid and moves on. The problem is that this normalization causes people to ignore a frequent symptom. A sign that, if properly treated from the start, could prevent serious complications. People ignore it for years. When the burning behind the breastbone is frequent, intense, appears even without overindulging in food, or simply no longer responds to the antacids that previously worked, the picture is different. Untreated and uncontrolled gastroesophageal reflux disease can cause severe complications. The years: erosive esophagitis, Barrett's esophagus, which is a precancerous cell alteration, and ultimately esophageal cancer, one of the tumors with the worst prognosis when detected late. In addition, heartburn in the chest can be confused with angina or even a heart attack, especially in women who frequently present atypical cardiac symptoms that mimic digestive problems. This confusion can cost a life. When to worry: if heartburn occurs more than twice a week consistently, wakes you up at night, comes accompanied by frequent choking, chronic cough without respiratory cause, persistent morning hoarseness, or any difficulty swallowing solid or liquid foods, don't delay the medical consultation and request an endoscopy. Sign 13 has a clinical name that most people have never heard, and it may be happening to you right now. Sign 13. Feeling of incomplete bowel movement. You go to the bathroom, you push, you wait, you have a bowel movement, you finish, you stand up, and immediately feel like it's not over, that there's still something inside, that the intestine didn't truly empty. You try again. Sometimes a little more comes out, sometimes nothing. The feeling persists. You've been living with this daily, for weeks or months. This symptom has a clinical name: rectal tenesmus, and it's not normal. It may indicate problems in the rectum or anal canal, changes in the functioning of the large intestine, chronic active intestinal inflammation, or polyps and tumors growing inside the rectum. They create a real physical sensation, the sensation that there's still content to be expelled, even when there isn't. The tumor takes up space. The intestine interprets that volume as stool, and you end up in a cycle, going to the bathroom without being able to fully relieve yourself. When to worry. If the feeling of incomplete bowel movement persists consistently for more than 2 weeks, especially when accompanied by changes in the shape or caliber of the stool, presence of blood, rectal pain, or weight loss, see a doctor and request a colonoscopy. Sign 14, you can test right now. Place your hand on your belly and see what happens. Sign 14, pain when pressing the abdomen. Right now, while you're reading this, do the following. Place your hand on your belly and press gently at different points, starting from the lower right side, then the upper right side, then the center, then the left side. Did it hurt at any point? Did you feel a different sensitivity? A pain you weren't expecting? That's not normal. Pain on abdominal palpation, even mild, can indicate something. Localized intestinal inflammation, appendicitis in the early stages, before it evolves into something more serious. Gallbladder problems such as stones or inflammation. Liver problems, pelvic inflammation in women, or, in more serious cases, an abscess or abdominal tumor, pressing on internal structures. The location of the pain matters greatly for diagnosis. Pain in the lower right side is the classic sign. Appendicitis. Pain in the upper right side points to the gallbladder. Liver. Diffuse pain throughout the abdomen may indicate peritoneal inflammation, which is a medical emergency. When to worry? Any pain on abdominal palpation that is consistent, localized at a specific point, and progressively worsens over hours or days, especially when accompanied by fever, nausea, vomiting, or intense muscle rigidity at the touch, requires immediate medical evaluation. Don't wait until the next day. And sign 15 is the clearest of all, and yet the most ignored, with a 4-word phrase that can cost a life. Sign 15. Blood in the stool. Even just once. Even small amounts. Even just once. Even that small red stain on the toilet paper that you saw and quickly tried to forget. That's not normal. It never was. It never will be. The phrase, "it must be hemorrhoids," is something doctors hear. Worrying frequency. From patients who arrive with advanced colorectal cancer. Already diagnosed. You should have come sooner. You should have investigated when you first saw it. You shouldn't have assumed. Yes, it may be hemorrhoids. It may be an anal fissure. It may be something completely benign and treatable. But it can also be a bleeding diverticulum. Inflammatory bowel disease in crisis. A polyp that has started bleeding. Or cancer of the colon or rectum in its early stage, where treatment can still be curative. Completely black and shiny stools are even more serious than red blood, with the appearance of coffee grounds. They indicate bleeding in the upper digestive tract, in the stomach or duodenum, where the blood was digested before reaching the stool. This type of sign requires immediate emergency care. When to worry? Always. Without exception. Any presence of blood in the stool, whether bright red, dark, in small or large quantities, once or repeatedly, deserves medical evaluation and colonoscopy for investigation. There is no normal blood in the stool. Never assume it's hemorrhoids, not without confirming with a doctor. Emergency signs, go now. Regardless of any sign on this list, there are situations that require emergency care without delay. If you or someone close to you presents any of following signs, don't wait. Don't research more. Don't take medication at home to see if it improves. Go immediately to an emergency unit. Sudden and intense abdominal pain that doesn't ease, the kind you've never felt before, like a stabbing or a rupture from inside, vomiting with bright red blood, or with the appearance of dark coffee grounds, completely black and shiny stools, without any use of iron supplements, an abdomen that becomes rigid as a board when touched, with intense pain at the slightest pressure, high fever above 38.5 degrees Celsius, with localized abdominal pain that progressively worsens, skin or eyes with a yellowish coloration that appeared rapidly within days. Any combination of 2 or more of these signs at same time. These are real emergency signs. There is no time to wait when the body sends this level of alert. Your body never lies. It has no reason to lie. It only speaks in ways we haven't learned to hear. We were taught to normalize discomfort, to resist pain, not to dramatize, not to bother the doctor, because of a bloated belly or a fatigue. That won't pass. And this culture of minimizing one's own symptoms costs lives. None of the 15 signs you saw here is A for panic. They are reasons for attention. Intelligent attention, not anxious. There's an enormous difference between falling into despair every time your belly hurts and developing the real capacity to recognize a pattern. The symptom that has changed in nature. The sign that persists beyond what it should. The discomfort that always appears alongside another sign. The new sensation that has been there for weeks, and you still haven't done anything about it, if you identified with any of these signs. Throughout this content, especially if they are frequent, recent, or progressive, don't delay the consultation. Don't wait to get worse before acting. And if you know someone who normalizes abdominal discomfort, who always has a justification for not going to the doctor, who thinks it will pass, share this content now. Because sometimes the right information arrives at the right time and makes all the difference.